I'm going to go ahead and start. We're coming to you. I'm filming. I'm saving this on my computer at the same time as filming it live on Instagram. Thank you for joining me on Instagram. I wanted to talk a little bit about universal health care because I had an experience yesterday that just, I already believed in universal health care, but I wanted to bring home the personal connection to this particular issue. I had a twofold here yesterday because I can't afford dental care that will cover, one partial denture or an implant or anything like that. So my insurance requires you just have it pulled, and that's all they'll pay for. And that sucks. That's really crappy. That's treating people like dirt, is what it's doing. And I remember reading a lot about the poorest times in the leading up to the French Revolution and to the English dissatisfaction in the 1800s. And it's just, this poor dental care is a telling symbol of how the poor are treated. It just really is. And universal health care, one of the things that's really great is the universal part of it is that it needs to include dental care. Dental care is something that corporations and elite dentists make big profits off of. And it's not just dental care that's important. Hello, thank you for joining me. Mental health care is largely ignored. We have mental health care, but my mom was retired from working at a state hospital in Napa as a social worker. And due to budget cuts and more budget cuts, people were put out on the streets that were not considered criminally insane. And I live just south of Napa, and just south of me is a city called Vallejo, which, hi Vallejo, love you. There are a lot of mentally ill people on the streets in Vallejo because it's difficult to get adequate mental health care. Our government largely ignores this. They may offer once a week counseling, maybe even twice a week counseling. But if you're not considered dangerous, you're out on the street and you wind up homeless, and you're out in an island in the middle of the highway with the sign saying, can you give me $1 to get something to eat? And our government government should treat people like people. It's supposed to take care of people. It should meet people's needs. And yet it treats people like dirt. And it favors the wealthy. Drug companies are highly inflated, as you know. You hear it talked about all the time. We in the United States pay drug prices 30, 100 times as much as they pay in Canada or France or other countries. We have drug companies like Pfizer that moved to Ireland to avoid paying U.S. taxes. So we need to get this stuff done. We need to get rid of politicians that take corporate money completely, but especially from drug companies and insurance companies like my opponent. You know who that is. Mike Thompson, if you don't. The insurance companies are one of his biggest donor classes. But he also takes donations from all kinds of drug companies, including drug companies in Germany and Japan, and it's crazy, his donor list. But it's no surprise that he is not, he's agreed to co-sponsor after a lot of pressure, single-payer health care, but it's no surprise that he doesn't actually work for it. And he's now starting to work for a bill for mental health care, which is great. But if he would work for single payer, it would include mental health care. But he's not. He's ignoring it. So this is what I mean when I say it's not like he's on the wrong side of the issue. It's that he's not working for it with any kind of intent. There's no intent. And in fact, he worked to pass PAYGO. And he I don't know if it's still on his website, but it was on his website about how important PAYGO was. PAYGO is austerity. PAYGO makes sure that single-payer healthcare can't happen. Because in order to pay for single-payer healthcare, we have to cut $300 billion from our budget. It doesn't matter that we actually pay more in healthcare now. It doesn't come out of the federal budget. And so it's just so frustrating to have a tooth pulled because your dental care sucks and you can't afford better health care. It's frustrating to go to the optometrist to get glasses and have, some things paid for, but other things not so much. It's a little bit better now than it was a few years ago, but it was, I think I used to have to pay $50 or $100 for my glasses, but I could have a visit. I think they pay for the glasses now though, but only certain frames, and it's kind of crappy. They don't know those are the frames that wealthier people can have, and these are the frames that you can have. Hi, we're talking about single payer health care, the importance of universal health care. We're talking about how it's crappy to have people that can't afford better dental insurance to get shoddy dental care. I've got family, and I don't want to, I'm not going to point fingers, but I've got family that are dentists, and I know that dentists can make bank. So, it's just really crappy. So I think I'm going to end the video there. Thank you for joining me. I'm going to save this, and I'll post it around. Facebook seems to have banned my political page in a shadow ban. They didn't tell me. My post stopped showing up. They just unavailable. So, have a good one, and we'll see you in the next video. Thanks.